Yes, well, I want to welcome everybody. We're so excited to have a team of researchers with us tonight to talk about their journey and the work that they've been doing, and of course that this is through Classy, and I'm Suzanne Smith Rowley, and my partner Zoe Mayu is unable to make it. She's actually in Bali teaching right now. And believe it or not, I had a phone call from a mother looking for an OT evaluation this morning. And we got to talking, and she said, oh, you really need to be doing trainings in Southeast Asia. And she was from India, and she was so happy to hear that we were there. And I know many of you are from all over the world, so I just want to welcome everybody. And also Dr. Roseanne Schaaf, who's our Director of Research, and you guys will hear a lot more from her. She's going to be doing a lot of moderating today of the discussion. So if we go to the next slide, I want to thank Southpaw Enterprises for their ongoing support of our webinars, and they've been supporters for many decades actually, and so we're totally grateful for that. I'm going to hand it over to Roseanne to do the introductions.
There you go. So welcome, everyone. Tonight, we're going to be hearing from Dr. Kelly Harris and Dr. Catherine Hoyt, who will be talking to us a little bit about their podcast on demystifying research. And I asked them specifically to focus in tonight on implementation science. So we'll hear a little bit more about implementation science as well. And I really hope that this conversation will spark your interest and further your understanding of how we can bring evidence-based information, evidence-based interventions into practice and continue to study them and forward the theory and practice of them. So next slide, please. I'll introduce our speakers. I'll start with Dr. Kelly Harris, who's an assistant professor of occupational therapy, surgery, and public health. She's a speech and language pathologist and has provided services in medical, educational, and community settings for more than 20 years. Her clinical interests include the effects of pediatric chronic disease on developmental and educational outcomes, sickle cell disease, asthma, health disparities, school-based chronic disease management, and the implementation of academic supports for youth with chronic disease. Dr. Harris is specifically interested in the impacts of sickle cell and asthma on academic achievement and attainment for youth, school-based chronic disease management, and the use of dissemination and implementation science to improve health and educational equity for youth living with chronic disease. And then we provided a link to her website as well. We can go to the next slide. And Dr. Catherine Hoyt is an assistant professor in occupational therapy, neurology, and pediatrics at Washington University in St. Louis. Dr. Hoyt's research focuses on identifying methods to screen children with sickle cell disease for developmental delays and developing a referral program for early intervention. With improved methods for early identification, more children can be referred and take advantage of beneficial therapeutic interventions during critical years of neural development. Love that. And also you can see her website information as well. So we can go on to the next slide then. Thank you for being here again. Here is a little screenshot that shows you their podcast called Demystifying Research, Dialogue on Training Careers and All Things Research. I love it. And I think you might have like upwards of 20 or more different podcasts now. And here's just some of the topics that are on the site. And I just wanted to introduce everybody to that and give you the URL so that you can explore it at your leisure. As Dr. Hoyt was saying earlier, people can just listen to it when they're taking a walk, while they're cooking dinner, and then, have more in-depth discussions about the research process. So I'll start now by posing a question, asking you, can you tell us a little bit more about your background and how you became interested in research?
Sure. Kelly, is it okay if I just go ahead and get started? Okay. I got interested in research kind of the slow way, I would say. I really wanted to be a pediatric occupational therapist since I was a young child. My parents were foster parents, and I grew up seeing the impact that early intervention could have in those first few years of life and how important it was. And I wanted to be a part of that. I wanted to be an early interventionist so badly. And then I became one, and I still am one, and I love that. I love being an early interventionist. But what hurt for me after I became an early intervention OT and being able to provide those services was seeing that not every child had the same access. There were some children that perhaps had less access because of where they lived, or their families weren't as aware of those services that could be available, or maybe their pediatricians or other people in their life didn't know about about early intervention being available, or the potential for intervention services to help their child master developmental milestones and be prepared to successfully enter school. And so it was those questions that drove me to go back for a research degree. And that's where I am now.
Yeah, so glad that you pursued that path. And I think we'll have a lot of overlap of your areas and the areas that many of our listeners are interested in as well. Dr. Harris?
Yeah, so I have a kind of similar story. As was mentioned, my clinical background is as a speech language pathologist, and I had done a little bit of research in school, but not in pursuit of a research career, just because I had extra time in my undergrad and grad school schedule. And I enjoyed it, but I wasn't like committed. Um, and I worked clinically for quite some time. And I think in that time, I started to really see things that were bigger than kind of my speech therapy practice could provide. I was starting to understand more about the challenges that the kids that I was seeing were having, and how they were really broader than my field specifically, and then our allied health fields kind of broadly. And I was really interested in trying to better understand some of the kind of social um, uh, barriers and challenges that families were experiencing, and just thinking more broadly about education and health and how these things kind of all fit together. I felt a little bit like a Band-Aid on a gaping wound. And so that led me to go back to school to pursue a PhD in education and public health, and really try to better understand how we can and should be supporting youth with chronic conditions and other things that are, existing kind of at the same time as some of their other like speech and language delays and those kinds of things. So I was interested in that, but I really wanted to understand the bigger picture and provide better supports to the families I was seeing.
That's wonderful. I love that you both are clinicians and clinician scientists. I think that's a great model for many here, and that you're both interested in understanding the big picture. And in fact, one of the taglines for Classy is "Children Understood." Helping to understand the challenges, the barriers, the facilitators to helping children and families achieve their highest potential and lead their best life. Can you tell us a little bit now about your impetus for creating the Demystifying Research podcast and your journey through that?
Yeah, I guess I can kick that off. So Catherine and I, work together, and we our research kind of overlaps in some areas. And so I think we're having some conversations around not only those similarities, but kind of similarities in our own exposure to research, kind of before we began to pursue research careers, our own experiences and understanding. I think just kind of sharing all the things we didn't know, all the things we didn't understand, kind of all the things we didn't know coming into it. And some of those conversations led to what began as a limited series webinar to kind of just share some of that information. We were getting questions from potential learners who might be interested in pursuing a PhD and wanted to be able to address some of those questions. And so we started with this limited series webinar to just really talk about the things that aren't often spoken about, right? If you don't have somebody in your family who has that's in a research career, has, you know, an undergrad or graduate degree, you don't have that exposure to research careers, and we wanted to just demystify that process. And so I think that's what kind of led to us starting, and then we've continued. We transitioned from that limited series webinar format to a podcast format because we had continued interest. We were getting questions. And so there was kind of always something to continue to talk about, to have an episode about, to address questions that we were getting from prospective learners, from current students, from folks who were already in research careers, just things that they wanted to hear about. So that's what I would say. Catherine, you want to add to that?
I feel like you were alluding to this, Kelly, but one thing that you have said, I think, to everybody that we interact with, the learners that help us with the podcast, and as we've talked about why did we do this in the first place, and how long do we continue, was that there's a really big unwritten curriculum in research and in academia. And I think you familiarized me kind of with thinking about it in that way, that until you know, you don't know, but that isn't fair for everybody. And we wanted everybody to know, what are the things that nobody has said to you that perhaps could change your pathway, or make an opportunity more accessible or available to you, or help you navigate that path towards a career that is meaningful for you, and hopefully able to contribute to the health and well-being of our communities as well.
Yeah, and I love what you said about that there is unwritten sort of curriculum or information. And I think this is especially true for clinicians, because many of us in OT have gone into OT, as you two did, to practice clinically. And then we recognize that we want to learn more. I think Marco's in that boat right now. And, you know, knowing what to expect or how to navigate that is really helpful for many of the young clinicians who are thinking about careers in research. Can you maybe just mention a couple of, you know, your favorite podcast titles that might whet people's appetite a little?
Kelly, I saw you smile. I don't know what your favorites are, but I have like some real favorites that I just was excited to throw out there. I really like our episode on how to write a recommendation letter with Dr. Allison King, is one of my favorites. I think it is so useful. I also like our episodes focused on preparing an application for graduate school and thinking about an interview. And I also really like the one that's OTD versus PhD versus EDD, to help walk people through what those different degree paths could look like.
I particularly like that one because I get that question all the time, and now I have a resource for people.
Yeah, Catherine, I have to agree. The recommendation letter one is one of the ones I probably have shared the most as a resource for others. It's excellent. I think I really like, I don't remember the exact title, so forgive me, but we have one about kind of just inclusivity in science and research broadly, I think is really interesting. And the other thing, I think we have another one on kind of we had a couple of international student guests who really talked about their experiences and their perspectives. I don't remember the title of that one either. I don't know if you do, Catherine, but I thought that was really interesting because I think for me, it's a lot of things that I haven't had to think about. And so I feel like I learned a lot about, you know, as a potential mentor, considerations, and just things that I think we should all understand when we're thinking about kind of different approaches and perspectives coming into research training and research careers, right? There's, we all have kind of different experiences. And so that was one that I really found useful. Catherine looks like she's finding the title.
I found it, called
There you
Success
go.
as an International Graduate Student.
Yeah.
I linked it here in the chat directly to the episode, but I also really liked our Successful Advocacy in Academia episode too.
I like that one too, as well. Yeah, there's a couple I haven't listened to yet, and I'm anxious to get to them. Thank you. Many of our participants are clinicians who are interested in understanding research to guide their practice. Some are also interested in participating in research and even conducting research. And I wonder what advice you might have for them as they strive to improve their practice, utilize research, and participate in research.
I guess, I think that that's actually a really hard question, because I know as a clinician, I talk about this a lot with the learners that work with me. There isn't a lot of time in your day necessarily to read up on every research article, but it is your responsibility to be familiar with what best practice is and how you can integrate what you've learned from the research to do the best you possibly can to help that child and that family engage in meaningful activities. So I think the way clinicians can do that, is by listening and engaging as much as you can. So I think there's now more than I've ever seen in my career. Since I graduated, there's podcasts and like OT Potential has a lot of opportunities for kind of engaging with current research and how it applies to clinicians, and looking at best practice guidelines, looking at really big reviews. So, for example, I'm thinking of one review that was done of motor interventions for children, and they created a wonderful stoplight of different interventions and the level of evidence for them. And I think using those types of tools to help guide your practice can be really helpful. In terms of being engaged in research, I think reaching out to people that are doing research is a great place to start. I think one thing I was surprised about before I went back for my PhD as an occupational therapist, I got connected to some people that were doing research just because I was curious. I wasn't planning to be a researcher yet at that point, but ended up getting hired as a research occupational therapist to implement interventions or conduct assessments or help develop assessment batteries. And I didn't know that was even a role that an OT could be in, but it's actually a highly needed role, and not that many clinicians get involved in research in that way. And not many researchers know the skills that therapists have. So they really need to work in collaboration for those intervention projects to be successful. So I'd say reach out.
Yeah, they're great suggestions. That role of OT researcher is really important, and it can be a valuable stepping stone, as it was for you, into a more research career. Anything to
I
add?
would add is, I think Catherine kind of hit it, but I think thinking about it also from a perspective that, research needs that clinician perspective and that kind of on the ground and the forefront, like really always present, because Catherine said she's still an early interventionist, and we both, have practiced clinically, but I think not all research is close enough to practice all the time to have that perspective. And so I think it's really important for practicing and active clinicians to really engage. And I think as clinicians, we see very different things, right? We can work in different contexts, we can work in different places. So bringing that perspective in is really important. So I just want to add that while yes, getting that experience and engaging is really important, bringing your experience and perspective and expertise is also really important.
Yeah, well said, well said. Well, this is a wonderful segue into one of the topics that I want to talk about tonight, which is implementation science, one aspect of research. And implementation science, for those of you who aren't aware, is a fairly new, science of research that studies what they call the black box between research and practice, to understand how evidence-based interventions can be successfully integrated into practice. So it's very practice-oriented and grassroots friendly. So I wonder if you two can tell us a little bit more, or tell the audience a little bit more about implementation science and your opinion on its value and place in research.
Yeah, I guess I can kick us off on this one. So implementation science is really trying to understand. So, we do all of this work in research, and the time it takes for what we have learned that works in research settings to actually make it to practice is quite long. We say it's like 17 years, and that's, for those of us that work with kids, that's their childhood, right? They are no longer children by that point. And so thinking about how we really shrink that timeline and understand better what the implementation factors are that impact our ability to kind of more rapidly move what we learn in research into practice. And so where a lot of times we're thinking about, with a particular intervention, let's say like, does this work? Right? Thinking about effectiveness or efficacy. With implementation science, we don't want to just know, does it work? We want to understand how feasible it is, how acceptable it is, what are the factors that are impacting implementation, how appropriate it is in a specific context, those types of outcomes. And so thinking about that while we're also thinking about does it work, and for whom does it work, and those types of questions, trying to simultaneously think about those factors. And then what are the strategies that help us to implement the things that we know work well in varied contexts. I think the other thing I would add, that's really an opportunity for implementation science, is that a lot of the research that we have is not representative of the populations that we serve, right? So there are many populations that have been excluded for research for decades. And so when we think about that, how do we build kind of a more equitable knowledge base that is that is more inclusive and that is more representative? And so implementation science is this opportunity to think about those factors kind of early on in the research process, and to also think about that in terms of implementation. You can't take the same thing into every community and implement it in the same way. There are various factors that change how individuals, families, communities want to interact with us and want to receive these things. And I think we have to be kind of open and aware. And I'll stop there and let Catherine jump in.
Yeah, well, I'll just make a comment that, I love that you talked about this research to practice gap, and that research goes beyond studies that say, does it work? Into how can we implement it? What's the feasibility, acceptability, what factors are impacting implementation? Because that seems to be right where we are in occupational therapy using air sensory integration, in that we have evidence now for its efficacy, and we are starting to push it out. I call it pushing it out into, looking at its feasibility in other settings. We're looking at what are the facilitators and barriers for utilization by minoritized and other populations, as you said so eloquently, Kelly. So it's really good to get the wheels turning of the participants, or of some of the kinds of questions that we can be asking now of this one occupational therapy intervention.
I just wanted to add to that a little bit, that while implementation science as a field is newer, I think 2010 or so is when the first groups came together forming the language and theories, models, and frameworks around implementation science. But there's decades of research and knowledge on knowledge translation, and there's a lot of other words that have been used for these ideas. People have been thinking about, how do we translate what we know works, or the evidence that we do have, to more people quicker? We all want to do that, I think. I think most healthcare providers and most researchers want to provide the best care that they can. And when we know that there's an intervention that can make an impact, would love to see more children who could benefit from that have access. What implementation science does uniquely, I think, differently than where we've been in the past, is giving it structure and methodologies for that, with a unified language set for how we talk about implementation strategies. There's a paper, there's the ERIC strategies that came out, I think, Kelly, correct me if I'm wrong, I think like 2016, by Byron Powell, that describes 72 identified implementation strategies. So that way, if we're all using the same language to describe what we're doing, we can more adequately reproduce that. So if I did an intervention in St. Louis, Missouri, and I described these same implementation factors that contributed to this, who was the population that I was working with? Where were they? Was it in a clinic? Was it in the home? What type of clinic room was it in? You describe everything about it, and the specific implementation strategies that you used to help translate this intervention into practice. That way somebody else then could say, oh, Catherine was able to do this in this way with these types of supports, if we get, that's the evidence we need to get funding perhaps to then provide this type of support so the intervention can happen. And I think that's where really where implementation brings us to that next level of moving our evidence into practice. And there is another side to implementation, which is dissemination. When you go to most implementation science websites, you'll see dissemination and implementation, D&I research or D&I projects that are working towards that, pushing it out and making sure that more people are aware of it. I'll put
Yeah,
a-
it's
Okay.
great that implementation science is more in the mainstream. You know, I know for me, for example, it's been less than 10 years that I've known about it. But when I did go back into the literature, I saw that it's been around a long time, and certainly that knowledge translation's been something that has contributed to implementation science. And I really encourage the participants, if they're interested, to look at some of these other resources that we're talking about, and that also will show you at the end as well. What do you think some types of questions that implementation science could ask?
I think for me, my implementation science asks a lot of the questions are like what you mentioned before, those facilitators and barriers. What are the things that can create opportunity and what are the things that limit participation, but also asking the like who, what, when, where, why types of questions. Is this even an intervention that you want to receive? And if you do want to receive this intervention, how would that look? And so for me, those are the pre-implementation questions. And I use a framework called EPIS for that, which is the exploration, preparation, implementation, sustainment framework. And I'm in that beginning phase of exploration. What does that intervention even look like? And setting us up for developing an intervention that is ready to be implemented, because we've started from that early stage of asking, what would you want it to look like? Where do you want it? You know, do you even want this type of intervention? Or maybe I'm starting from a totally different place than the people that I'm intending to support by saying, I've got this intervention that I want to provide, but perhaps there's a knowledge gap that like and the family may not be ready for that type of intervention. Maybe we need to target in a different way, or we're missing another component, or the way that we've been talking about the intervention isn't matching the goals and priorities of the family that we're intending to support. So I'm in a lot of that pre-implementation, and I think my questions look a lot like that. I think, Kelly, I think you have different types of implementation questions than me.
I know, I think that's a big one, right? I think, so we do a lot of community engaged work. So asking those questions on the front end, helping, thinking about implementation strategies. You mentioned the ERIC strategies. Those in 2019 were adapted by Clayton Cook and colleagues for the school setting. And they have what's called the sister strategies, which take those 72 ERIC strategies and translate them to a school setting. And so thinking about, what are those strategies that we need to use or we need to think about as we're implementing interventions, and not as the researcher identifying those, but really working closely. I work with schools, so partnering with schools to understand for their context which of these are most appropriate. I think that's a piece of it. I think that's also not just a pre-implementation though. That's kind of iteratively throughout the process, right? Understanding, because we can think it's a good idea and then learn that it's not, or learn that, it doesn't work for whatever reason. And so I think continuing to ask that question throughout the process is important. The only other thing I would add is the idea of de-implementation. How do we stop doing what doesn't work? And I think in education and in our fields specifically, that's a thing. That's something that we can sometimes have a hard time with. And so I think really thinking about not only how do we increase uptake of the things that do work well and that are, really feasible, acceptable, appropriate for our specific context, communities, families, individuals, et cetera. But how do we stop doing the things that perhaps aren't as effective or aren't as acceptable to our clients, with our clients?
Yeah, great points. You made me think about what we're doing right now with taking air sensory integration and thinking about its application in schools. And so we've had students doing work that's looking at the facilitators and barriers to its implementation in schools using the EPIS framework, Catherine. So I was glad to hear you. Our latest student is doing a survey with administrators and teachers, to find out if they feel like it is useful, is it feasible, is it something that they feel like they can be in support of, and how could it work, and those kinds of things. But we've also engaged a number of therapists across the United States to give us information about that. And I also loved, I can't remember which one of you said it, they made a school-based adaptation and they called it Sister Strategies. Yeah. Was that?
Yes. Oh, I'll tell you. Hold, just give me 1 second. I can drop the link.
Yeah, I'll just, while you're looking for it, I just love that. And I think it's a good way to think about how we need to, and might have to adapt, the evidence-based manualized protocol for air sensory integration so that it is implementable, if you will, into other practice settings, and study its feasibility, its usefulness, its acceptability in those settings.
And just to note, Roseanne, that I shared the links for the ERIC strategies and the sister strategies on the
Oh,
chat.
good.
So
You found, great. Thanks, Marco. You're on top of things.
you're welcome.
Yeah. So what would you say would be a good way to get started in implementation science research if somebody's interested in it?
I mean, I think learning about it, reading, there's, there are a few different implementation science specific journals. There's lots of kind of research or literature available that I think that would be a first step. It's one of the things that I did when I was trying to understand what is this thing that's called implementation science and why should it be important to me. I did a lot of reading just to try to kind of understand. And then I think the other thing is there are many tools. And so I think kind of learning and finding some of those resources and thinking about, how does this fit within whatever work you're doing clinically. So I think that's the starting point. It's just kind of getting into the literature, seeing what's out there.
Yeah.
Go ahead.
Oh, Kelly, I was just going to say self-plug. We have an episode on what is implementation science on the Demystifying Research
That's right. That's a good one.
with Lisa Juckett, who is a fantastic implementation scientist and occupational therapist at the University of Ohio, and a part of the Learn Network. So I would highly recommend listening to that. Lisa Juckett has some wonderful things to share. But apart from that, I would say I agree with everything Kelly said, but I would check out some webinars. If you go to YouTube, the NIH and NCI both have really great introductory webinars to implementation science. And the implementation science journals are often, most of their articles are open access, which is unique for research, I think. So I think that's a really cool opportunity to read what some of the implementation and dissemination and de-implementation science and newly coming information is available. You can definitely access it. If you can't, let us know. We'll definitely help facilitate you getting access to any articles that are of interest. But also Washington University, where we are in St. Louis, has a Center for Dissemination and Implementation Science. And the University of Washington in Seattle has a great dissemination and implementation science website and resources too. And so does UNC. And I'll put a couple of those in the chat. Go ahead, Kelly.
There's one more, Catherine. University of Washington actually has a module that's like a for practitioner kind of what is implementation science, really short course. So I'll find the link. I'm not as fast as Marco, so give me a second.
Okay.
But I'll drop it in. But that's a new thing that has just come out in the past few months. It's like a self-guided online training on implementation science.
Yeah, there's a lot out there. I put the National Cancer Institute, Marco, I think that's the other one that they mentioned, has a webinar series that looks at, gives an introduction and then some theories, designs, and how measures and strategies. And then there's other resources that I put the Washington University main link there, as well as the demystifying research. So I think they can maybe navigate there. And some other, and I wanted to also just come back to the LEARN network, because that's a learning health systems rehabilitation research network that provides support for implementation, science, and learning systems in order to improve rehabilitation quality, value, and outcomes. And I had the good fortune to attend the LEARN session last year in Washington, D.C. I think it's every year, they have a training series where they bring in scientists who are interested in learning more about implementation science and converting their research, or I should say, making the path of their research toward implementation science. And I just met some great people and got some great mentorship that way, and feedback on projects that I had already been working on, and how to sort of craft them into implementation science projects. So it was really, that's another resource. Okay, I think at this point, if there's anything else that you want to add in, Catherine or Kelly, please do, or we can see if there's any specific questions from the listeners. Marco.
We do have some questions, and if there's more questions, please use the Q&A, so it's easier for us to go through them. So there's this question about the distinctive features of implementation science and other types of science. What would be the biggest division or differences in this type of science?
I did actually have a question like that I didn't ask, like to clarify the difference between something like intervention research and implementation science research. Maybe that's a little more specific.
Mm-hmm.
Do either of you have thoughts on that?
The video was choppy for me. Were you able to hear the question, Kelly?
Was the question about the difference between intervention research and implementation science? I didn't catch the original question, but I thought I heard your response.
Yeah, the original question was, what are the key differences like between implementation science and other research? And then I just focused it down to intervention research versus implementation science. But you know, you can do broad or specific, whatever works for you.
I guess my first thought is that intervention research is often looking at the aspects of an intervention and does this work? So efficacy or effectiveness. And whereas implementation research is looking at, okay, now that I have this evidence-based intervention, how can I help this intervention be used more by the target audience, whatever that may be? So you're not asking, does it work at this point? You're asking, how do I get it to be used in implementation research? If you want to answer both of those questions, there's what's called a hybrid type trial, and there's hybrid 1, hybrid 2, and hybrid 3, and where you're perhaps focusing primarily on efficacy, but asking some of those pre-implementation questions. So you're kind of preparing for that later sets of implementation, or you could be asking more implementation questions, but have a couple of efficacy level questions too. So it doesn't necessarily have to be completely separated. It could be a hybrid trial.
Thank you. We have 2 questions that I think are similar or related, at least, and they're due with this idea that really takes a lot to bring research to practice, but there's also a disconnection between practitioners and research, right? So there's this gap in these 2 worlds. And so it's really, do you have any suggestions how we can approximate, how we can bridge these 2 different areas that might not be that different, but what what are your suggestions for who's in the field, considering academia and also in practice?
So how bringing basically practitioners together with researchers to, yeah, I think about this a lot. As I mentioned, I work with schools, and my kind of ground level, base level assumption is that I can't do any of this work without the buy-in and support from folks in the schools, right? Teachers, I work a lot with school nurses. Chronic disease is my area of interest. School administrators. And so I also walk in with the assumption that they know more than I know about their setting, about their students, about what's important and what matters. And so when I can kind of put my own ego and interest to the side and just go in and listen, it's really helpful. So I think it's necessary that we do this to kind of get to the question. I think research in general is thinking and talking more about kind of community engaged approaches, and that doesn't just, I think our clinicians and practitioners who aren't engaged in research right now are part of that community. And thinking about how we, as from a research perspective, we think a lot about how we are better partners and building better partnerships in the work that we're doing. So I think, I don't know, this is not a direct answer to the question because I don't know that I know the how, but I think working with researchers who want to build partnerships is a way to start. And I think as researchers, we really have to, that should be our starting place, right? One of the things I learned early, I had like this great set of questions and aims that I wanted to work with. I wanted to partner with some schools to talk about. And the first thing they did was like, these aren't the questions we want to answer. Like, do you want to answer your questions or you want to answer our questions? We'll help you answer our question. And so together we revised that. It was, the subject matter was still the same, but really thinking about how am I benefiting the communities I'm hoping to benefit, and so I think if we can all kind of take that approach, that's one way to think about how we kind of bridge that gap and start to work together more. It's not a direct answer because I don't know that there is an easy direct answer, but I think both, it's important for folks who are, primarily clinical and wanting to get into research to actually take those steps to start to engage. And then I think we have to be receptive and seek out those partnerships also.
Yeah.
There's a couple other questions. Oh, if you don't mind me jumping in here, about from the practitioner side. And I'm always interested in that since I've been in practice all these many, many years. And like, what can we do? Do you need to have a doctoral degree? And again, kind of dovetailing with what you just said, but we have to partner with our doctoral level, PhD level researchers who understand the rigor of the design and how to craft the questions carefully. And then on our part as clinicians, we have to do good record keeping. And I think that is one of the most important things that I learned early in the game, that if we had messy records, it was really impossible for somebody to use our data. So how was somebody given their diagnosis? Who diagnosed them? What kind of assessments did you use? Was there continuity in the assessments? Was there rigor in your assessments and your data collection? And then, so keeping that data, and then also informing researchers of the trends, because as practitioners, we start to see trends before it shows up in the research, which is really frustrating in one hand, but on the other hand, it informs what's going on in real life, that then we need to take a look at this, whatever that is.
I just want to say two things. I think partially addressing some of those questions you listed, right? No, you don't have to have a doctorate to be engaged and interested in research. And I think a first step, as clinicians or practitioners, we know what we are interested in, we know what we're into, we know what we care about. Find somebody who's doing that work that is aligned with what you're interested in and what you care about, right? And then just talk to them, have a conversation. I have someone who works with me in my lab now who had questions and was interested in research and was working clinically as a speech language pathologist, but wanted to engage. And so now she works with me, and we work together to address our shared questions. And so I think just having those conversations and like thinking about what, what is it that you're most interested in the clinical work that you're doing, and who's doing that work, and finding those people.
Which is really similar to our episode with Emily Kringle about, so you're interested in research, what's next?
Yeah.
And it's like really basically that advice that Kelly just gave, and it just is making me laugh because that wasn't my intention to just call out different episodes. But I do think it's a compliment, because one thing I didn't understand before my research training was how much time and consideration goes into every question that's asked, and how it's asked, and the data that you collect, and to what was shared, like making sure that our data collection is thorough and thoughtful and rigorous. And as clinicians, some of that data could be used even retrospectively if you got appropriate consents, if they're thorough enough. So we could understand, maybe does this evaluation take too long? If the therapists recorded how long the evaluation took for over years, you could then go back and say, maybe this is why this particular tool isn't ideal for this clinic, because it's taking 4 hours, or maybe it takes 4 hours, so we need to ask for more funding to cover this, because in order to adequately address and identify what the concerns are, we need to do this longer evaluation. But without that, I just came up with that out of nowhere, but like without that level of information, you might not be able to answer the question that you're seeking to answer.
Yeah, really, really great points. Thank you. Any other questions that we have?
I think we've touched on most of the questions we have. I
Okay.
actually have one, and I think it's more not at an intro level, but here am I. This might be a personal question, but I think there's a lot of people in this position as well. Because being an international student, and also, for where I am, when I think about being a researcher, you think about academia, perhaps teaching, perhaps doing some research, perhaps a mix of both. But what else is out there that, how can you actually perhaps match this two sides of clinician and research, and become a clinician researcher or researcher clinician? I don't know what goes first, but do you have any tips on that? What else do we have? Do you have any podcasts on that, by the way? And where can we see and plan to the future, not only to be involved, but what you can be in the future?
So are you asking about like jobs outside of academia?
Yeah.
That
Yeah. So, and
okay.
even for people that follow a PhD or a doctorate, but don't
Right.
necessarily want to be involved only in academia.
Yeah, I think so it's interesting. I'm at like a conference of sorts this week right now, and there's someone here who does research, who has a PhD, who works for the State Education Association, and has the ability to guide policy in that setting, right? So there's those kinds of settings. Catherine, jump in if you have other thoughts. There are research settings that are not academic, not centered at academic institutions, right? Yeah, certainly industry, nonprofit. I think there's lots of ways. I think I don't even know them all, but those are just a few that come to mind quickly.
Mm-hmm.
I think there's a lot of industry type jobs outside of the academic circle that you could do with knowledge and research. So I know a lot of people that have gone from PhD to industry, and that could be in any type of organization. Some people, I've known people in rehab PhDs that have even gone to pharma and worked in research there. You could also definitely go work for nonprofits. or community-based organizations, helping with grant writing, helping with developing their outcome measures. I see Doug Lean put that in there, and that's certainly true. So I think it's depending how you want to use those skill sets and how you want to be engaged. It certainly could be academia. Many programs gear towards that, but that isn't the only path. I think the skill sets are useful in a lot of places, and lots of big companies hire researchers too. So I put Apple in there because I know that they hire rehabilitation scientists. And so does Google. They have a lot of technology and they're seeking to better understand how it's being used, how it is interacting and affecting people's lives. And many data people that are focused on maybe the engineering aspect of things aren't as focused on how that technology is being used in everyday life. And that's ultimately what a lot of people want to know.
Yeah,
You know, one of the, go ahead, Ron.
just to build on that a little bit, I think occupational therapy is seeing its day, because now health scientists, people are interested in how they can live their best life, and what are the aspects of that are going to help do that. And so I do think that in those kinds of organizations as well, occupational therapist skill set can really be of value.
Yeah, what I was going to say is it's not even all over the world about the accessibility to higher education. For example, in the US, we have to have a master's degree to practice OT, and we usually will be working on a project such as, critiquing research or doing a small project in OTD. It's something different. But when around the world, there's a lot of practitioners at a bachelor's level who really want to continue. And I don't know what the advisement is, but I do think if we could partner, to have these international partnerships, and Marco, maybe you could talk about this too, because it's a long journey to a PhD. But people who are really interested in contributing, I don't want you to feel discouraged, because it seems like that sort of degree route is too far out of reach. I think there's other ways to contribute.
Mhm.
So
Absolutely.
I agree with that. Research is not a solo endeavor. I don't work alone. Catherine doesn't work alone. None of us work alone. And so it's very much a team. It's a team, it's teamwork, team science.
Yeah, I
And-
just want to, oh, go ahead.
No. I just was going to say that, everyone on our teams doesn't have a PhD, but they are all very much needed and everybody has a role. And so I think that, if you're interested, asking the question to try to, we are always looking for people to who are passionate about the work, who are interested in the work, who, want to learn and want to help us answer the questions that we're interested in. So that's all I think. That's all I was going to add.
I
Yeah.
think the comment there that practitioners can be site champions is absolutely true too. And so like what Kelly is saying is research, I can't endorse that wholeheartedly enough, that research is not a solo endeavor. It is a team effort that requires skills and energy and passion from people with a lot of different knowledge sets. I only know what I know, and I definitely don't know everything. And really heavily rely on my collaborators, on practitioners, on people with many different areas of expertise that can support the work to make it happen. So if it is something you're interested in, I think Kelly's point of Google a little bit and see if there are other people engaged in work that is similar or somewhat aligned, and see if you can set up a 15, 20 or 30-minute call or something to see if there's an opportunity to collaborate. And there might be a chance to visit the lab or to sit in virtually, or if you happen to be in a close proximity in person in lab meetings, or to participate in some way. I think Kelly and I have both done that. Actually, one of the articles that was in OT Practice related to demystifying research happened partly because somebody reached out to us and just said, I'm interested in getting involved in the research process. Can I do something? So we wrote an OT Practice article.
Yeah. Fantastic. Yeah, thank you so much for all of your knowledge and expertise and taking the time to share it with us tonight. And thank you to all the participants. We have a great host of a lot of accomplished participants on the webinar tonight, and it's so great to have you here participating and supporting these efforts. I'll turn
Yeah,
it
thank
over.
you. Yeah, well, thank you, Kelly and Catherine, and also Roseanne. I love ending on that note of it's a team process, and collaboration is in partnership. That's our byline with Classy. So I'm going, oops, I've got to be enabled as co-host. I'm going to pull up a couple last little pieces. Of course, you guys remember we have our raffle at the end. Here we go, but all righty. We do want to show you these podcasts that we've been talking about. This represents a true dedication to the topic, and I have had the privilege to listen to a couple of them. They're absolutely riveting. Honestly, I guess that's a little bit nerdy, but I found them incredibly interesting, and I wanted to listen more and more. So I would encourage you guys to join some of those. Roseanne put together an amazing list of resources that's here, and we'll make that available with the podcast, but I know it's a little small because there's so many. So thank you for putting that together. Just a reminder, we have our Classy program where we're trying to do the implementation of the science and putting that into the hands of our learners so that we can get that into practice to be as effective as possible. And our next webinar will be at the same time. I'm sorry to Marco, who's it's the middle of the night for him. But being US centric, this was the time that we thought we'd have the most possibility to have our team available. So August 21st, and that advertisement will go out, our summer session, and then you see we have 3 more after that, September, October, and November. Those dates are up. So I'll pass this over to Marco or Melissa. One of you guys has the winner.
I have the pleasure to announce the winners. So we start with our Easy Starter Kit, and the winner is Janet Labiles, and I'm very sorry if I'm mispronouncing your name, Janet. Congratulations. It's just one Easy Starter Kit. And then for the SOTPA equipment, the winner is Nirel Patrice Montes Claros. So congratulations to both of you, and thank you for watching.
All right, so congratulations to the winners, and thank you, everybody. Stay well, stay safe, and until next time, okay, do your research.
Yes.
Bye-bye,
Okay.
everyone. Thanks
And
again.
team up.
Team up.
Team up.